Hello, today we'll be talking briefly about some advances in thermoregulation and some of the things that we can do to help our babies live the healthiest lives possible. The objectives that we'll be discussing today are talking about hypothermia, the impact of it on morbidity and mortality, and why it's so important for our neonatal patients. Some of the specific strategies included in this presentation are the use of a pre-warmed radiant warmer, the environmental temperature in the delivery room or resuscitation room at 23 to 25 degrees Celsius, the use of a plastic bag or wrap, as well as heated humidified gas in the resuscitation room. We'll be talking about the plastic cap and exothermic mattress. Now let me simply say that in this brief abbreviated conversation, we won't be going into detail on all of these, but all of the information on those is included in the full slide deck that's included in the link. Let's begin by talking a little bit about what hypothermia is. We won't be able to achieve it if we don't know what it is we're trying to achieve. So our goal is to maintain a normal temperature for babies at 36.5 to 37.5 degrees Celsius. Anything less than that is hypothermia. And the World Health Organization has further defined hypothermia into mild, moderate, or severe hypothermia, with the temperatures listed on this slide. The rates of hypothermia are surprisingly common, and you may find that in your individual NICUs, if you were to do an audit of what your actual hypothermia rates are on admission, they might be higher than you expect. In a Canadian cohort, babies less than 33 weeks gestation were found to be hypothermic on admission over 1/3 of the time. And this isn't just because it's cold in Canada. A California cohort as well showed that over 1 in 2 babies that were very low birth weight were also hypothermic on admission. So it's a significant problem that's more prevalent than you may think. Now, why do we care about it? We care about it because it's associated with significant problems. Number one, it's associated with death. The more hypothermia there is on admission, the more likely a baby is to not survive their NICU stay. And this graph here demonstrates not only the death, but also the long-term problems. There's an association with mortality and morbidity. A composite outcome including mortality, severe neurological injury, severe retinopathy of prematurity, necrotizing enterocolitis, bronchopulmonary dysplasia, and nosocomial infection demonstrated that the more hypothermic a baby was, the more likely to have a negative outcome. And this was particularly true as the temperature dropped below 35 degrees Celsius. Now it's important to note that the rates of those complications or problems also increased in hyperthermia. So in our zeal to prevent and avoid neonatal admission hypothermia, we have to be very careful not to creep into hyperthermic baby outcomes as well. If our goal is to avoid hypothermia, we need to understand how it occurs, and understanding the mechanisms of heat loss is very important for this to happen. And this occurs by 4 different mechanisms: conduction, convection, radiation, and most importantly, evaporation. Evaporation is the number one method of heat loss in premature or even term infants. And this is in premature infants because of the large surface area. They don't have vernix, they have very, very thin skin, and the dry inhaled air or oxygen in the resuscitation room can also increase the likelihood of evaporative heat losses. The International Liaison Committee on Resuscitation in 2015 published guidelines for preventing hypothermia in preterm newborns. And these guidelines include the use of a radiant warmer during resuscitation, maintaining an environmental temperature, or in other words, the temperature of the delivery room and resuscitation room at 23 to 25 degrees Celsius. For babies less than 28 weeks gestation, there's a recommendation to keep the delivery room above 25 degrees Celsius. For all babies, warm blankets should be used, and for those babies less than 30 weeks gestation, they should be placed in a plastic wrap or bag without drying up to the shoulder or neck immediately after delivery, notwithstanding delayed cord clamping. So delayed cord clamping could be done first and then placed in a plastic wrapping or bag without drying. The use of a plastic cap has been reported on as well, and thermal mattresses is currently a recommendation of the International Liaison Committee on Resuscitation. So the use of plastic wrap or bag has been studied probably more than any other intervention in recent years. And what this slide shows is the difference between those babies less than 30 weeks gestation resuscitated with a plastic bag compared to those not resuscitated with a plastic bag. And the average temperature is dramatically improved when the plastic bag is used. Of note, without a plastic bag, normal temperature was not achieved until between 90 and 120 minutes following admission, compared to those babies used in plastic bag, in which the admission temperature was normal much more often. Now, more recently, there was a study that demonstrated the use of heated humidified gas in babies less than 32 weeks gestation to be beneficial. This was not included in the recent ILCOR guidelines, simply because the publication came out after the ILCOR guidelines were in the final stages. But what this study did is it took babies less than 32 weeks gestation, maintained the delivery room at 23 to 25 degrees Celsius. All babies were resuscitated with a plastic bag. And the difference was some babies were randomized, this was a randomized trial, some babies were randomized into heated humidified gas while others were randomized into no heated humidified gas, or rather oxygen and medical air directly from the wall. And there was an increase in the number of normal thermic babies. In those with normal gas from the wall, there was a 55% likelihood of normothermia, whereas that rate increased to 69% when the heated humidified gas was used along with the other interventions. Now, importantly in this study, the rate of moderate hypothermia or worse dramatically decreased, as you can see. So the recommendations to maintain temperature are to pay special attention to a number of different things, all focused on minimizing the mechanisms of heat loss, specifically the use of pre-warmed radiant warmers during resuscitation, maintaining the delivery room and resuscitation room at 23 to 25 degrees Celsius, the use of plastic wrapping without drying, the use of a plastic cap, heated and humidified gas in the delivery room, and you'll note here that I put plus or minus exothermic mattress. You'll have to look back at the slide deck to see why there might be some concern with the exothermic mattress, specifically as it relates to increased rates of hyperthermia as some of the other interventions are employed in your neonatal intensive care units. As you look at this together with your group, it is my expectation and belief that you will see your rates of hypothermia on admission decrease, and you will be able to help your babies live the healthiest lives possible. Thank you.